So Marissa and I were talking about some of the coolest benefits that we've seen out there, as well as plan designs, and we were kind of going back and forth and wanted to share those so that people know what they could be doing within their plan. So Marissa, I know you had a couple. Why don't you start?
Yeah. So one of the benefits that you can put together for you and your employees is maybe paying your employees to actually see a provider. For example, let's say you needed a knee replacement surgery and you established a direct provider contract with that surgeon, and you paid your employee $2,000 to go see that surgeon, and you also waived that deductible.
Which you're incentivizing them to make a better choice as to what provider they're going to, maybe on the basis of quality, but also cost. In a perfect world, both of those, cost and quality. So we're going to go to a high quality provider, and in a U.S. healthcare system, cost and quality are inversely related, and it could be at a lower cost. And sometimes that's $10,000, $20,000, $30,000 in potential savings that why shouldn't you share with your employee? Right. One of my favorites is one that has been around for some time, and that's maternity benefits. So you can quickly analyze providers in any given area and help pregnant mamas determine what's the best place to have my labor and delivery. Going even beyond the location of where you're delivering, but there's services out there that offer maternal fetal medicine expertise, where if you engage in certain programs at the end of your term when you deliver the baby, we can give you free diapers and wipes, because we know that there's a lot of high costs associated with pregnancy and delivery, and in some cases, perversely high costs that we can evaluate and help lower in the claims in the back end. So as somebody that wipes tushies, including one this morning for my 16-month-old, diapers and wipes get expensive, right?
That makes sense, doesn't it?
It does,
yeah,
it does.
Yeah. What about just paying nothing for your prescription drugs? As an employer, you can evaluate paying a $0 copay for not only your entire employees and their families, and waiving that amount that they might be paying out of pocket for maybe specialty drugs, brands, generics. People are using those all the time, and there's a nice option out there to consider.
You know what's wild is, and there's articles that are coming out about this constantly, we're paying, in some instances as plans, unbeknownst to the employee, hundreds, if not thousands of dollars for generic medications that in most cases are less than $5 or $1, or we can just make free on the plan, and they're common compliance medications. So why wouldn't we want our diabetics, hypertensive, those with hyperlipidemia or high cholesterol to not be on the medications that could potentially prevent a catastrophic claim or event or loss of life?
Right. So there's a lot of good solutions, and here at Benefits DNA, we're going to evaluate all those options for you and provide you with an individualized solution.
That's why at Benefits DNA, we fix your healthcare.